Now let's go a layer deeper to talk about the subdural hematomas, which, as the name implies, are caused by bleeding into the subdural space. This is the space between the dura mater and arachnoid membrane. Notice how this guy's drink is spilling inside the car, right in between that dural pocket and that... what is that? Oh my god, it's a spider. An arachnoid, if you will. Subdural hematomas are caused by tearing of the bridging veins that drain the cerebral cortex into the dural venous sinuses. So, not only is this guy's drink a venous blue, he's also tearing through those blue seatbelts inside the car. Subdural hematomas are usually caused by rapid movement of the brain, as in a car accident or fall, leading to trauma. In infants, the bridging veins are thin-walled, and subdural hemorrhages can occur with child abuse, as in the case of shaken baby syndrome. In older children and adults, blunt trauma to the head is the most common cause, and anticoagulation therapy, such as warfarin, increases the risk of developing subarachnoid hemorrhages, hence the warfarin war vet shirt. Additionally, anything that causes cerebral atrophy puts the patient at high risk for a subdural hematoma. This is because when there's decreased brain mass, the bridging veins have to travel further to get from the parenchyma to the dura. This puts them under extra tension, making them more susceptible to tearing with less force. So elderly people, who usually have some degree of cerebral volume loss, are at higher risk. Other common causes of decreased cerebral volume include neurodegenerative diseases such as Alzheimer's disease or chronic alcoholism, in contrast to what's seen with epidural hematoma. During a subdural hematoma, blood is free to travel around the subdural space and is not contained by suture lines. This gives them a crescent shape, represented by the shape the spilled blue drink is formed inside the car. As with all brain bleeds, a non-contrast CT of the head is the diagnostic test of choice. Look for that crescent shape to light up. Subdural hematomas, while definitely not benign, are usually much less of an emergency than epidural hematomas. In fact, you can even have a chronic subdural hematoma. Crazy, right?